the organ and you are giving a life to the patient. Then comes your structure and functions, because masticatory efficiency, phonetics, and then the support and retention, and how patients are going to swallow, deglutition, everything it is, can be corrected. So the defect wise, maybe it is a smaller defect or it is extended up to the your posterior pharyngeal walls. Then you have to record the throat form of the patients through the functional impression making. Then you have to deliver, and the pharyngeal part of it, whether the patient is efficiently can manage or any insufficiencies there, how to rule out everything. It is through a prosthetic calculations you have to deliver the dentures. Then patients are conscious, because patients initially, if you are giving any kind of a bigger prosthesis, the patient will have the, what to say, he will not never use. So always go for the sleek kind of hollow kind of prosthesis. So patient may wear it and he will say, okay, happily, no, I can wear this kind of prosthesis. Now the trend is going on. So how to make a sleek kind of obturator prosthesis. Then improvement of patients, because whenever the patient comes the first visit, he will be horrible. The second visit, he will say, okay, I'm accustomed to that. So the third level, he'll ask for what is a permanent option. So always think of implants. So in the facial, whether you are going to give it for the obturation kind of patients or the facial structures loss patients. So where is the bone quality and quantity? There and all, you can go for the implants. Next. The extraoral processes, again the patient retention is slowly it's compromised with the kind of adhesives it is stick to the patient's nose, ear and other things. But only the future kind of augmentation is through the implants. So these are all the photos, my college photos I never put. So these are all from the textbook Buma I have given. Next. So the operators for features, for speech prosthesis also it is there. So always you have to initiate the patient is giving a very good speech or nasal emission is there, so that you have to check, because we don't know the defect extension. So we have to do the endoscopy. So what is the level of posterior extension we have to check, then according to that we can give a very good prosthesis. Next. So in the babies, all the babies you cannot give just like that impressions. So when the feeding kind of plate, if you want to give, the patient, the baby should show the very good crying signs. So without crying sign, if you take impression means, then it will end up in not only, the baby may collapse also. So that you have to check whether the baby shows a very good crying sign, then only you have to deliver take the impressions. So in technological perspectives, again, what are all the materials and methods they are saying? The 3D printers, you can use it for the laser sintering. So the metal infusion, and you can make it as a layer by layer. So there are a lot of things, zirconia, metal, lot of things you can utilize with the laser sintering. One more, the advancement in the prosthodontics. It's not the prosthodontics, but anatomical wise, you can utilize the Baga system. So those days, they'll say the cochlear implant, if you replace, the audition will be very good for the patient. The autism, whoever the audition, that is a middle ear defect kind of patients, they can use this kind of Baga system. So where exactly they're going to give a implant, that implant will receive the signals and it is going to compensate for the ear loss. Next. Then this bionic eyes, this is also one of the important thing, because the optic fibers will be okay, but the retinal kind of photoreceptors, it's not working for the patient means, you can keep a bionic kind of implant system in the posterior wall of the retina. So that takes the photosensors and according to that it gives signals to the brain. So through that you can enable the vision. So this is one of the advantages. So this is nothing but these are all my patients. They have come to our dental college. So we have tried one of the advanced technique called photogrammetry. So it's nothing but with the cell phone you can take the pictures, the 3D pictures, and you can make the 3D data. Then through that you can get the augmentation of whatever the process is. So this is one of the future perspectives also we are trying. Next. So advance in maxillofacial materials, the nanoparticles and the color stability. Sorry. So again, I've told you nanoparticles when you're going to work. So where and all it can be applied, that you have to check. Because nanoparticles, now there are the neurosurgeons, they are saying you should not use. But there is a debate is going on. The research literature always supports for the nanoparticles. Why in our field it's very, very important? Because as a filler, the nanoparticles gives a very good strength for the material as well as the color stability. For the maxillofacial materials, whenever the patient exposed to the sunlight, the color will go fade up because he will be paying a lot of money for the maxillofacial process. The color fades means what to do? Again, the patient cannot come forward. So what we can add it up. So the nanoparticles like titanium, zirconia and cerium that can be added up. So this will retain the color. So then nano coating efficiency also reduces the titanium oxide nano coating also reduces the color fading efficiency. Next. So finally I want to conclude. I am very tired now. Okay, I don't know whether it is an interesting kind of topic what I delivered here because lot of things I want to discuss because even for TMD they'll say that is the temporomandibular joint disorders. So how well we can treat the patients, whether they are the clenchers or the bruxers, what is the kind of therapy, prosthodontic therapy we can give and what kind of orthopedic TMJ position we can deliver to the patients. That is also very, very important. So that's it. Then comes the sleep apnea. So what is happening in sleep apnea? எல்லாம் சொல்லுவாங்க கொரட்டை நல்லா விடுறாங்க எங்கள் ஹஸ்பண்ட் கூட சொல்லுவாங்க நல்லா தூங்குறேன் கொரட்டை விடுறீங்க. So how to manage that? So the posterior palatal wall you have to check the uvula is falling back. So how to correct the uvula? Then about the tongue, glossoptosis is there, the tongue, so superior bulge of the tongue is there. So how to reduce that? So you cannot go for surgery or anything. So any advancement, kind of mandible advancement technique, you can make it through functional appliances. That is also there. So it is a wonderful journey to travel in prosthodontics. So first initially when I took prosto, that too in my younger year, so all the professors, they all like what to say, villan மாதிரி தான் இருப்பாங்க ஒன்றும் சொல்லிக் கொடுக்க மாட்டாங்கல்ல. But when you go near to them, I'll have the kind of whether what they are going to scold me or they are going to throw the dentures out. So this is my kind of journey I travel. But slowly I got my interest towards this. So now everything is going on very well. So I want very meritorious students. Everybody, general practitioners also, they can do successfully in this kind of prosthodontic work. So you can take the very good ideas from your clinicians, that is prosthodontic practitioners, and you can do a wonderful job. Everything is open to all. So no hiding truth in this. So that's why I'll say I am a learner. I am learning all the days. Whenever the book comes to me, so I'll go on learning. Then my learning aspect is not reduced. So now I am expecting Kazim is going to bombard me with questions. I have a fear to Dr. Kazim. So what is that? Like an LKG student, I have a fear towards Kazim. What is he going to ask me? So how is the lecture? Is it okay? It's okay or not? Okay, thank you very much. So a lot of things to be added up because my slides and all, it's not very well made. Anyway, my excuses.